Okay. All right, good. Let me welcome everyone who is tuned in to our webinar show today, participants and speakers. Good day, good morning, wherever you are, and good night. I just received an email from someone in China apologizing that they're not able to be on and asking that they get the recording. It's midnight in China. My name is Gordon Tapper, former Section Chief at the United Nations, founder of the Give Them a Hand Foundation, president of the United African Congress, and a board member of the African Renaissance and Diaspora Network. This is our seventh in our series of webinars, all with the overarching theme of the coronavirus in Africa. The one difference today is that we will not dwell on the virus itself, but on its impact on different categories of society. In this case, gender disparities, its impact on women and girls. These webinars are being sponsored by the United African Congress, the International Association of Applied Psychology, Give Them a Hand Foundation, and the Black Star News, and we are all here. Collectively, over the years, these organizations have been very concerned with healthcare in Africa. Starting in 2014, when we were the first partnership to host a forum on the Ebola outbreak at the United Nations. That was in 2014, in August of that year. That resulted in a number of expatriate groups getting together and sending containers of medical equipment back to Sierra Leone, Guinea, and Liberia. We also held a major event in the United Nations General Assembly Hall, at which the Secretary General, Ban Ki-moon, was the opening speaker, followed by Ambassador Samantha Power of the United States and Ambassador Tete Antonio of the African Union, and he's now the Minister of in government in Angola. We also, following that, held a meeting with the Office of the Secretary General to submit a proposal to his office, which included the first call to establish an African CDC. In that same vein, I am pleased to say that today in South Kivu, Democratic Republic of the Congo, we are in the last days of a program that Give Them a Hand Foundation, United African Congress, and International Association of Applied Psychology have partnered with Hope and Help Vision to help the Democratic Republic of the Congo combat COVID-19. And we have some photographs that we would like to show you of the women, most of the women who are gathering at the site where we were distributing the masks and training them how to wash their hands and to provide them with information and the infographics, which contains information on good sanitation and on giving psychosocial support. We hired women to make masks, which they distributed to people in the communities. Again, we established 5 hand washing stations, as well as the infographics that I mentioned to you before. We partnered with the Health and Hope Vision, and I believe the president of that association is here at the moment, Jean-Marie Bazibou. And if you're here, congratulations on a job well done. And as you can see on the screen, the women and the crowd that were lining up, we had over 700 people in the first 2 days who came to the mission that we were doing. These projects, I should add, are funded solely by the leadership of our organization. We are small, but we have a major impact on the world stage. We know we can do more, and we will do so with your help. Our next program is called Africa Rise, Healthier and Stronger. And it's a virtual fundraising event that will take place on the 24th of October, United Nations Day. The purpose of this event is to raise funds to purchase mobile clinics, to build and/or repair district health centers, and upgrade others in rural, underserved communities in Africa. You will hear more about it, and we will ask for your support. However, You're not here to listen to me speak. We have a group of experts who are well equipped to address the subject of today's webinar. But first, I want to invite the audience to post their comments in the chat box and also to input questions for the Q&A session. First, we have Professor Shahana Rasool. She's a social worker who obtained her undergraduate degree in South Africa. She obtained a master's and doctorate from the University of Oxford, Department of Social Policy. Shahana is a professor of social work, and she was the head of the department at the University of Johannesburg from January 27 to December 2019. She's the vice president of the Association of Schools of Social Work in Africa and is Africa representative on the International Association of Schools of Social Work. The next person who we have is Mr. Eric Dentor. He's a child protection specialist for UNICEF and gender-based violence in emergencies. He was a refugee himself and pretty much grew up and had his early education in the UN refugees camp. Next is Ms. Sophie Chirongoma, senior lecturer from Midlands State University in Zimbabwe. Then we have Ms. Mino Ramarosan, regional coordinator for Africa for the Wairo Commission. And Wairo happens to be the name of the town in Beijing, where the seminal Women's Conference was held in 1995, and at which the women of the world committed to changing the status quo in a meaningful way via the Beijing Platform for Action. The next speaker is a brilliant young lady from South Africa by the name of Nonhlanhla Jiyane. She is a South African representative of the African Renaissance and Diaspora Network. She has a fabulous project, the Red Card Project, that she will soon tell you about. Miss Clarisse Mefotso comes next. She's trained in public health. She's a founder of African Hope Foundation, an organization that works every day in support of women in her native country, Cameroon, as well as the continent of Africa and amongst the diaspora here in the United States. Then there is Asiata Kamara, a partner of our groups on the Ebola events and on other events. She heads the There Is No Limit Foundation, and as the name suggests, she wants young African girls and women everywhere to know they can achieve anything they set their minds to. And with that, I will call on the first speaker, Ms. Shahana Rasool. Shahana, it's now your call.
Thank you so much, Gordon. Hello to everyone. Can you hear me clearly?
A partner of our groups on the Ebola events and on other events.
Okay, greetings of peace and solidarity to all my sisters and brothers who have joined us today. Thank you to the 4 hosting organizations for this wonderful seminar. I'm going to get right into it. So gender inequality is a worldwide phenomenon, not just a problem for Africa. With the advent of COVID, these gender and other inequalities are exacerbated. And we see the gains that have taken decades to achieve slowly slipping away. COVID has highlighted the inequalities of our society. It has shown the cruel face of how our society is organized to reproduce inequalities. We see this starkly in violence against women, which is the extreme consequence of gender inequality. GBV has been referred to as the shadow pandemic, since it has tripled internationally since the outbreak of COVID. The increased rates of reporting GBV around the globe has ranged from 30 to 200%. In Uganda, for example, in 1 month, a total of 3,280 cases of GBV were reported to the police. We have seen high numbers of the GBV reported to the GBV hotline in South Africa, which reported 120,000 calls in the first 3 weeks of lockdown. However, this issue seems to persist because pre-COVID, many of our attempts to address GBV have failed. Why is this? I believe it is because we are not doing enough to address gender inequality more broadly, which is the underlying cause of GBV and other issues. Despite arguments which suggest that addressing gender equality is imperative for the overall development agenda in terms of economic growth, stability, enhanced productivity, as well as its cumulative effects on other dimensions of welfare, such as education, health, and family. So despite these arguments, progress and commitment in funding to address gender inequality has been varying and inconsistent, since gender discrimination is embedded deep in the culture and structure of society. And it is particularly accentuated in the area of care. I contend that the most fundamental matter to focus on if we are to tackle gender inequality is care. The triple burden of care, which refers to the role women play in three areas, production, reproduction, and community care, still weighs heavily on women. So what is care? The word care brings up images of our mum and grandmum and the way they took care of us, right? That is the important role women play in the area of reproduction. But often, they also take care of not only our families, but probably other kids and families, as well as the elderly and sick in our communities. And that we refer to as the community care role that women play. In some parts of Africa, we call this engagement Ubuntu, which means we are because of others. And this really emphasizes the community spirit that abounds in African communities, especially in times of crisis like COVID. There's various community groups, even those with few resources, which were led and implemented by women who have self-organized to provide food through soup kitchens or food distribution, while waiting for governments who, despite already knowing they were going to put communities in lockdown, did little to ensure food security on time. Whilst it is also the women-led initiatives, women have also led initiatives to provide psychosocial support through community care. I was involved in one such endeavor to establish a WhatsApp counseling line during COVID with other women to increase access to psychosocial support for women and other marginalized groups. Often this community care work by women is unpaid. And when it is paid, it usually gets poorly paid in jobs such as nursing, social work, teaching, and domestic work. Globally, 88% of personal care workers and 69% of health professionals are women. And these are frontline jobs that require patient contact and therefore increase women's exposure to COVID, as these roles cannot be performed from home. So coming back to the reproductive sphere, women contribute to economies by and large by taking a large chunk of responsibility for the bearing and caring of children, as well as the caring of elderly and sick in nuclear and extended families. Pre-COVID data, I'm not sure if you can see the slide, in almost every part of the world shows that women spend practically double the amount of time on unpaid domestic and care work than men. So if we look at the slide, red is higher for women and black lower for men. This may be changing to some extent, but by and large remains the same. And in fact, it gets worse during pandemic times. If we specifically look at South Africa as an example, data shows that when comparing women and men between the ages of 15 and 64, on average, women spend 39 minutes per day caring for children in their own households, whilst men spend 6 minutes per day on childcare. And if we look at the average time men spend on care of persons in general, it is 3 minutes, even less. So in some African contexts where there are limited resources, the domestic chores of women and girls increase due to COVID, especially where there are restrictions on the availability of clean water or other resources like fuel, wood, and energy. So the triple burden of care is exacerbated during COVID for women and girls due to increased care work in the family, looking after the sick, as well as children who are going to school, which most of us are not going to school, which most of us are experiencing right now, whilst we're still trying to manage paid work or finding food or work for those who have lost their jobs during COVID. And this takes us to the third area of care, which is production. Pre-COVID, one of the important gains worldwide has been women's increased participation to 40% in the global workforce. Again, I hope you can see the slide. Yet women's employment rate still remains 25.1% less than men's. As you can see in the graph, with women in red, it's much lower than men's participation, which is in black. So even though women's labor force participation has increased, this indicator is deceiving since it does not account for the quality, security, and wage gaps in employment. In South Africa, for example, the mean monthly income for wages for women is almost 1,000 Rand less than the mean monthly income for men. Whilst women in Northern Africa hold less than 1 in 5 paid jobs in the non-agricultural sectors. And the proportion of women in paid employment outside the agricultural sector only increased by 6% in 15 years. And with COVID, women are most impacted in the economic sphere because they are more likely to have been in informal, insecure jobs such as domestic work, selling goods in markets or on the streets. And they're not covered, therefore, by social protection plans such as unemployment insurance. This puts women and girls at increased risk of exploitation, trafficking, sex work, child labor, and gender-based violence. So whilst a survey in 2017 showed that women are increasingly becoming breadwinners, or at least contributing to a large percentage of the household income, the role of men in households to assist with chores and caring work is still stigmatized as women's work. Interestingly, data from the USA shows that when the wife is the primary breadwinner, 41% of women still take the lead role in housework, and 37% take the lead role in childcare responsibilities. Similarly, in an international study covering 19 countries, 500 focus groups were conducted with men and women who viewed women's tasks as being largely associated with family care and home production, and men's with income generation and decision making. So in conclusion, if we want to address gender inequality seriously as a global community, it's not just about addressing descriptive representation. So putting a few women in a few places of leadership and thinking the job is done. In some cases, descriptive representation has had a powerful effect. Examples are the current Prime Minister of New Zealand, or in South African context, the previous public prosecutor, Thuli Madonsela, or many of the anti-apartheid struggle activists like Alan Kuzwayo. But we also need to address substantive issues, that is, the underlying social-cultural issues in our systems, processes, structures, attitudes, and norms that allow for gender inequality to persist. Do women have to organize and reorganize society separately from men, like the women in Kenya have done, to ensure we can make decisions that affect our own lives and to have control of our own bodies and sexuality, or to have access to opportunities? Or is it possible to address gender inequality holistically and meaningfully in our current social system? 30 years ago, some women in Samburu, northern Kenya, had to create a completely matriarchal society to be free of GBV, female genital mutilation, to escape forced marriages at a young age to all men, and other such practices. So these women created their own matriarchal village so that women can have voice, and so that they can engage men on their own terms as human beings, not sexual objects or property. Is this what is needed? Or can men take up the challenge to be equal partners in the provision of care? To not see women as property and sex objects, but equal partners in creating a just world? I leave you with these questions. Thank you so much. Siyabonga.
Thank you very much, Shahana. I very much like the approach you have taken to address the subject. Yours has been an all-encompassing commentary on the subject of gender disparities and also violence against women. It is a little disheartening to know that we men are doing not even half the amount of work I mean in terms of care, because we should be, I don't know if it reflects a lack of caring or simply our culture, but we should be doing a lot more in many areas. But I won't be dwelling on that at the moment. I will turn it over now to our next speaker, who is Mr. Eric Dentor. He's a child care specialist with UNICEF. And I know Eric is a great story, and hopefully he will shed some light on that. Eric, the mic is yours. Go right ahead.
Thank you so much, Gordon, and good morning from New York colleagues, and thank you so much for having me on this call today. This edition is going to touch more on the recent presentation that was made in terms of COVID-19 and the impact it has on women and girls. So basically, like the first speaker mentioned, I just want to say that gender inequality is not a new phenomenon in Africa. It has long existed even before COVID. If you compare women with men, women have been heavily engaged in every gender responsibility. They have less involved in decision-making and leadership roles, and they have unequal access to and control over information, technology, services, and resources, including income, land, and property. This inequality has placed them in difficult situations. Now, with COVID, we are seeing that COVID-19 prevention and control measures are actually deepening these pre-existing gender inequalities and increasingly putting women and girls at risk of gender-based violence, as mentioned by the previous speaker, while simultaneously making the services they need and the support networks they depend on less available. In terms of school closures, lockdown, and stay-home measures are creating new stressors for them, as well as increasing the burden of care on them. Like the previous speaker said, we are seeing women multitasking, even for the career women, where we have seen colleagues doing teleworking at the same time caring for their children, parenting, but also caring for the sick people. And that, of course, exposes them to the virus itself, but also other risk factors. We also know that lockdown means we have to stay home, but of course, stay home is always not safe for women. For some women, stay home means that they are trapped with their abusers in the same houses. We have seen increase of gender-based violent cases over the years. Over the few months, like the statistic you have had. In the past 12 months, we have seen about 243 million women experiencing gender-based violence from their partners. And this number is likely to increase as predictions reveal. And of course, as we talk about women and girls, we have to pay specific attention on adolescent girls because they have increased risks of sexual exploitation, child marriage, early pregnancy, as well as poor school outcomes or drop out from school. In terms of services, because this is something we have seen, COVID-19 pandemic is equally impacting access to existing gender-based violence services for survivors. For example, if you look at services like women and girl-friendly spaces, services, case management and psychosocial support services that have been provided in the past for survivors of gender-based violence. These services have been disrupted by COVID-19 pandemic. In some contexts, they are either closed. We have seen in some countries where these services are closed. In some contexts, we have seen these services not being considered as essential services. And in some contexts, we have seen these services requisitioned for other purposes like treatment center, quarantine centers. And then we have also seen increased demand for GBV services, particularly in location with partial lockdown. And now we are seeing the decrease in demand for GBV services in location with total lockdown. We try to inquire a bit why there has been decrease in some contexts for GBV services. It was noted that some women did not know if these services still functional because of the lockdown measures. But also for some women, it was completely unsafe for them to make calls in their homes while their abusers were in the same homes. And in some contexts, front workers, female front workers who are providing GBV services as well as healthcare providers require permission to access certain communities. And often they are also at risk of gender-based violence, physical violence, emotional violence, and sexual violence. And in some places, even physical violence. And basically, I just want to probably maybe touch a bit more in terms of addressing these gender inequalities is critical for ensuring that women and girls' safety and well-being is taking place. In March of this year, UNICEF issued 5 key actions for gender equality in the context of COVID, looking at some of the findings that we have had. The first one we look at is caring for caregivers. The previous speaker mentioned that about 70% of the caregivers are women, whom are midwives, whom are healthcare providers. These people need protection. They need protection in terms of protection services, they need healthcare services, and child care services. So caring for caregivers is something that we can do to address gender inequalities. And of course, we have to prepare for increasing gender-based violence. As mentioned, gender-based violence is surging in this COVID pandemic. So it is important for us to mitigate GBV risks as well as support survivors by training our frontline workers, making sure referral mechanisms are in place, but also engaging in community mobilization to make sure that communities are informed about available GBV services. But of course, maintaining the core health and educational services for women and girls, engaging and supporting the existing women and youth networks, for example, for connectivity and access to vital information about their safety and well-being. If you look at the context of COVID, you realize that women and girls have less access to information, looking at the responsibilities that they have in their households. And of course, data is very important. Ensuring that we have gender data available is important, because data disaggregation and analysis is critical for understanding, designing, and delivering gender-responsive programming. Gender-based violence gets worse in every emergency, and of course, COVID-19 is of no exception, like we heard from the previous speaker. And for UNICEF, this is a co-protection priority for us. And we are working closely with national government and partners to ensure, one, that there is access to and continuity of GBV response services, looking at the context of COVID, adapting services, capacity building and strengthening systems for service providers, working with partners to identify GBV risks and mitigate these GBV risks. That is also something that is very critical in terms of GBV risk mitigation across other sectors, looking at education, looking at nutrition, child protection, and the other sectors to make sure that GBV risks are identified. But also for non-GBV specialists to be able to handle disclosure of GBV cases and safely refer survivors. And then the important piece of it is the community mobilization piece of it, working with partners, community structures, and women and girls groups to integrate messages about available GBV services and help-seeking mechanism in race communication and community engagement efforts. One thing we have seen with COVID response is that the risk communication and community engagement activities have only looked at the health and watch needs, and not really looking at protection. And we are seeing evidence that protection is also important during these early stages of emergencies, including COVID. Since the start of this pandemic, UNICEF has played a central role in the call to action joint statement on GBV on COVID. This is a call to action for donors and partners to make sure that they increase their visibility and funding to GBV to addressing gender-based violence. We noticed that from the previous speaker, that funding is a problem in terms of making sure that GBV issues are addressed. And of course, UNICEF is funding and managing the global GBV AOR help desk. This is a technical research analysis and advice service for humanitarian practitioners working on GBV prevention and response in emergencies. So they provide lots of guidance, technical note on COVID and the rest. And of course, we have been providing e-learning series for the regions and supporting webinars and podcasts. I have that also. I have included the links in the presentation that will be very important for colleagues in the field to use. And then to conclude, we have partnership with 2 organizations at the moment. Voice is an organization here, is a women organization in Nonhlanhla. It's another organization that we are working with currently to conduct research on the impact of COVID as well as access to services. That will be very helpful in terms of improving our efforts in addressing gender-based violence in the future. And so far, we have over 70 countries that have trained their staff on the GBV Pocket Guide. I will encourage all the colleagues to look at the GBV Pocket Guide. We have included the links. The GBV Pocket Guide helps practitioners, particularly in locations where there are no GBV adults. How do you support survivors to avail the available services that are in that location? So we will share that in the link that colleagues can use. And then we have about over 75,000 staff and partners that have been trained in different countries. And UNICEF is making commitment to ensure that all countries responding to COVID-19 take on addressing gender-based violence needs. Thank you very much. This is the end of my presentation.
Thank you very much, Eric. One of the things I'm hearing from you and from Shahana before is how vulnerable women are, particularly at this time of COVID, where not only are there nurses, they're the ones who are going into the market, and they come home and they have to be taking care of children and are more exposed than anyone else. It is certainly a very unfair burden that has been placed on women, and it is something that we all need to be taking a very serious look at. Thank you very much, Eric, and I thank UNICEF for facilitating the presentation by you. Next, we have Ms. Sophie Chirongoma. She's a senior lecturer at Midlands State University in Zimbabwe. Sophie, it's now your turn. Sophie, Ms. Chirongoma, senior lecturer at Midlands State University, Zimbabwe.
Thank you.
Hello.
Can I proceed?
Okay. Thank you very much, Sophie.
Thank you, Gordon.
Okay.
Thank you very much for inviting me to contribute to this panel. And I would also like to acknowledge my son, Tadiwanashe, who is listening in, and my sister and my friend, Rose, who is also listening in. I'll start by introducing the work I do. Currently, I'm a senior lecturer at Midlands State University, where I'm teaching courses that focus on the intersection between religion, gender, and health. I'm also an active member of a women's organization, which is known by the name, the Circle of Concerned African Women Theologians. And normally we shorten it to the Circle. Founded in 1989, the vision of the Circle is to advocate for gender justice and also to assess how religious thoughts, traditions, and institutions affect women and men. The circle provides a platform for reflecting on how the major religious traditions in Africa, particularly the three major religions, which are Christianity, Islam, and African traditional religion. And so we are interested in seeing how these three major religious traditions shape and influence the status of women. And membership for the circle is open to all African women, whether resident in Africa or in the diaspora, as long as women are interested in pursuing the theme of gender justice. The main goal of the circle is to critically analyze how gender intersects with class, race, ethnicity, age, sexuality, culture, etc. to empower or disempower people. We are a well-structured organization with regional, country, and institutional leaders who are motivated to socially engage in theological research and also to engage in teaching and doing community service. I'm the coordinator for the circle chapter in Zimbabwe. We focus on an agreed research theme, which is interpreted differently according to disciplines, context, methods, and regions. Right now, that is between 2019 and 2024, our agreed research theme is religion, environment, and the sustainable development goals. As a circle, we are one of the most organized, productive, and effective theological institutions in Africa, and we engage in a lot of academic research and writing. In the past 12 months, we have been working on 8 academic books and journals, which will be published within this year and early next year. I'm the lead editor for 3 of these manuscripts. We are also into mentoring young women, students, and scholars who are interested in pursuing an academic or community career in religion. The title of my presentation is The Plight of African Women in the Wake of COVID-19. And to illustrate my points, I'll draw most of my examples from Zimbabwe, where I live and where I work. The first major point that I will highlight are the financial implications of COVID-19 on women. And as the previous 2 speakers have already highlighted, women and girls are disproportionately impacted, particularly here in Zimbabwe with a very high rate of unemployment, about 90% unemployment. As such, most women and girls are engaged in informal employment or informal income generating activities. And the measures of lockdown have heavily impacted on these activities. As a result, we have seen an increased number of women illegally crossing the border to South Africa because that is the mainstay of their sustenance. Usually, most Zimbabwean women cross the border to South Africa to engage in part-time or informal employment or working in the hospitality industry. And with the closing of the borders, out of desperation, most of them are risking their safety, their health and well-being by illegally crossing the border, where sometimes they are exposed to getting robbed or to being raped, or sometimes they end up hiring their services to physically transport the goods, where they are only paid a pittance of 50 rands per load, which is equivalent to about $2 United States dollars. And sometimes even university students are also engaged in these activities because they need money to pay for their tuition. Sometimes also women get exploited by regional truck drivers who assist them to illegally cross the border. And for those who remain at home during the lockdown phase, some have resorted to selling second-hand clothes in their homes or selling fruits and vegetables. And again, this exposes them to the vulnerability of being infected by the coronavirus. And others are also risking having their goods confiscated by the law enforcement agents who move around brutally beating up people within particularly the urban areas in Zimbabwe. And some women traders have also lost a lot of their investments during the lockdown, particularly those who are engaged in selling farm produce. Because initially when the lockdown measures were implemented, there were no clear instructions regarding markets, fruits and vegetable markets. And as a result, most people ended up losing all the produce that they had already acquired. And also others ended up losing their produce because the police were going on a rampage, destroying truckloads of these market products. And after they had lost their goods, the government later on came to apologize and asked them to come forward and claim compensation only if they are registered traders. But unfortunately, most of them are not registered, so they could not come forward and claim their compensation. The second point is domestic violence and violence against women, as has already been highlighted by the previous speakers. And according to Musasa Project, which is a women's organization that provides shelter to abused women in Zimbabwe, cases of domestic violence have increased since the lockdown came into effect. And mainly this is due to the fact that men are so agitated, again, because of high rates of unemployment. Most men are involved in the informal sector. And so because of the lockdown restrictions, they cannot go out and hustle to make a living. As a result, they take out their frustrations on women and girls by either sexually abusing them or beating them up. And another challenge that women are facing here in Zimbabwe, particularly in the urban areas, is poor sanitation facilities. As much as they are being encouraged to wash their hands and to use clean water, but unfortunately, they don't have access to clean running water. So they have to go out of their homesteads and queue for long hours to fetch water. And again, this compromises their ability to practice social distancing. And also because Zimbabwe has faced consecutive years of drought, the food insecurity situation is worsened due to the lockdown because women cannot afford to go and earn an income and provide food for their families. The third point that I will highlight is the increased cases of rape, sexual violence, and the infringement on the sexual reproductive health and rights for women and girls, particularly for adolescents. Because they are idle, schools have been closed since 20 March, and so they don't have much to do. As a result, they are experimenting with sex, and some of them are rushing to get married at an early age. And also, even for married women, their access to contraceptives has become very compromised because they cannot easily move from their homes to go and collect their contraceptives. And some of them who are married to conservative men who deny them access to contraceptives and they used to conceal them. Now it becomes very difficult to conceal the contraceptives because their husbands are always at home. And also women and girls who stay in the slums are much more susceptible to being raped and are not able really to practice social distancing, particularly those who were affected by Cyclone Idai in Chimanimani and Chipinge. It's a double tragedy for them because they are still living in temporary shelters, and so they are much more susceptible to being sexually abused, and for them even to access adequate food and shelter is a challenge. The fourth point is how women here in Zimbabwe are more susceptible to the infection because they are the bulk of the frontline workers. I'll give you two examples. For instance, here in Shahana, where I live and work, it's a very small mining town. There has been a record of 25 nurses and their families who became infected with the coronavirus. And as a result, the hospital has been closed as I speak. And also, because of the high rate of unemployment in Zimbabwe, most people have migrated for greener pastures. And there is a report that so far, 39 Zimbabwean nurses working in the UK died of COVID-19 because, again, they were frontline workers where they had gone to seek for greener pastures. And so it is a real challenge because women have become much more susceptible to the epidemic. In conclusion, as women of faith in the circle of concerned African women theologians, we have taken a stand to serve as the voice of the voiceless. Therefore, we are calling for resolute efforts on the part of our African governments, faith communities, and other humanitarian agencies to urgently address the gender disparities entrenched by the outbreak of COVID-19. I thank you, Ndatenda Siyabonga.
Gordon, you're on mute.
Hey, Gordon, you're on mute. You have to unmute.
Gordon, you're on mute.
Okay, all right. Thank you very much, Sophie. I was saying that I like very much how you weave the religion into the issue of women's causes, and included in that African traditional religion into this discussion with Christianity and Islam. People, especially in the West, sort of think of African traditional religion as something that doesn't exist and something that should not exist to a great extent. And thank you for putting it here on the table along with the Christianity and Islam. I should tell you that our organizations each year host an interfaith event at the United Nations each February. And we have all of the world's major religions. And on one occasion, only one occasion, and we must apologize for that, we had an African traditional speaker from Upper Guinea. And he was very interesting, what he had to say. But people's cultures, beliefs, and religion are very important to them and should be important to all of us. And thank you, Sophie. And the next speaker on our list is Miss Mimo Ramarosan. And she is as I mentioned earlier, the regional coordinator for Africa for the Wairo Commission. She will tell us a bit about the Wairo Commission. And please, Miss Ramarosan, the stage is yours.
Thank you, Gordon. Good evening to everyone, or good morning, depending. Thank you for inviting me. I'm Mino Ramarosan from Wairo Commission. Wairo Commission is a global grassroots women movement that was created during the Beijing conference 25 years ago. So now we are in our celebrating our 25th anniversary, and we are present in almost more than 40 countries around the world. We are in Latin America and Caribbean, North America, Europe, Asia, and Africa. Our work is really about putting grassroots women at the center, and we are looking at how to empower grassroots women to voice their needs and their expectation and be considered as agents of changes, but not beneficiaries anymore. The methodology we are using within Wairo Commission is about really training, improving skills of our grassroots women leaders, then doing peer learning, because they also have a lot of experiences that they they are sharing between themselves and then doing a lot of advocacy work. So we are present at the global stages in the last 25 years. I'm just going to give some examples on what we have achieved so far. But for example, we are very present in UN Habitat, so we have a memorandum of understanding with them. We are also a member of the global platform on disaster risk reduction. We are part of global land initiatives like the global land indicators initiatives, where we fought to have land indicators within the SDGs. And when we are looking into Africa, we are looking at also rural and urban grassroots women. We have our focus on health, on resilience and disaster risk reduction, especially with the droughts and cyclones and all the natural disasters that have happened in the continent in the last few years. We look into access to basic services, and we look into governance. And then one main point is also the land and women land rights, how the grassroots women are accessing land and using land. And then we have in Africa two main initiatives that we are working on. One that we call Women Land Link Africa, in which the grassroots women is coming together to advocate, but also share their experiences and share tools that they are having and that they are working in promoting women land rights and in getting land for the grassroots women's group. And then another one is the Home-Based Care Alliances, which was created as a response to the HIV and AIDS effects, and it's still ongoing, and it's looking into the impacts that it's having in the communities and what grassroots women are doing. And this is also an issue on how the women, our members, are not thinking about, it's not only about health, but it's really about social protection. Because when we look into this issue, we have the issue of food, we have the issue of incomes that we need to consider, and so on and so forth. In terms of the COVID, in the last few months, we had a lot of our members who came to us and reported to us the effects that lockdowns and curfew measure is having on their groups and the communities. The disease is of course there, but also the effect of the measures that they're taking to protect them, like when there is lockdown, then there's no transportation. They cannot like buy goods and sell their commodities. Markets are destroyed. For example, work are lost. So a lot of our women is living on the daily works, especially in Asia, for example, but also in Africa. So they cannot access food. So we decided, and also medicines, because there is a lot of complaints that we are having from our members that without transportation, the grassroots women cannot go and get their medicines like their ARVs and so on and so forth. And then we decided to put out small grants for the groups to prompt them and to support the grassroots women in their work, in their daily work as frontline responses to the disease. And it's providing them at least the communication that they need, because they say that they cannot, with the social distancing, they cannot meet each other, so they don't know what is happening to the other group. So we decided to give them the opportunity to get means to communicate between themselves, like use like internet bundles, phones with WhatsApps, or other apps that they can use. We also provide them means to create resilience in the communities. We do food relief, but also if the groups wanted to get some inputs for next season, cultural season, for example. And then we are looking also into the midterm solution of creating resilience, and then advocate and the advocacy work that they can do to be part of the initiative taken by the governments. Because if I'm taking, for example, Madagascar, where I live, the issue is that we get support from the government, but in the cities only, and the rural areas are also impacted. And then we have the rural women that now are facing the issue of not being able to sell their products in and get incomes, and then they cannot also have inputs to now do their planting. So now they are thinking about using the seeds to eat, and what about next cultural season? Are they going to be able to afford seeds and work on their land? So those are a few examples that I can give, but there is a lot that is happening, but time is really short. So thank you, Msotabita.
Thank you very much. Thank you, Mino. Thank you, Mino. And I know how the women feel, actually, because just this March, when the United Nations should have hosted the Commission on the Status of Women, the COVID changed everything. And the meetings were canceled, and the thousands of NGOs and women who would have come to New York did not materialize. And that was very unfortunate. Anyway, we will not dwell on that any longer. And I will introduce you to our next speaker. She is Nonhlanhla Jiyane. She's also from South Africa. And she has a very interesting project to tell us about. Nonhlanhla.
Thank you very much, Gordon. Good everyone, and good morning. My name is Nonhlanhla Jiyane, African Renaissance and Diaspora Network representative for South Africa and SADC. I'm also a member of African Women Leaders Network. EDN, we are an internationally operating NGO headquartered in New York. Our mission is to accelerate the advent of the African Renaissance by advocating for and supporting United Nations, African Union objectives in Africa and the African diaspora by mobilizing the passion of government, educators, artists, intellectuals, the private sector, civil society, and young people, using the power of art, sport, and culture as vectors for creating a better world. I would like to introduce a video by Tulani Miss Sundown and a law student. She's also a social media influencer. Thank you. Gordon, are we going to play the video?
I did not get the video. I'm looking for it right now. So if you want to.
Okay, please go ahead.
Keep going.
Go ahead.
I can try and find it.
No worries.
Johanna, you might take this opportunity to talk about the event, the red card event.
Yes. So we giving the red card to all forms of discrimination and violence against women and girls. This is the red card. I'm sure everyone is asking, why are we giving this red card? And what is this red card? Red Card campaign was initiated in July 2019 during FIFA Women's World Cup. And it was launched globally during the International Women's Day on the 6th of March this year, with the plan to collect 1 million pledges by 2022. Using the power of sports and the language that is understood globally to empower women. We continue implementing our plans despite the current pandemic experienced globally. The gender-based violence cases continue to rise at an alarming rate in South Africa. GBV has now been declared a pandemic within a pandemic, And therefore, government together with civil society are combining efforts to address these challenges. In response to this pandemic, Aid in South Africa has teamed up with TM Active, a PR company, and an athlete management company, and also Digitism, a company that specializes with digital marketing and Internet of Things, to implement the programs that will assist in creating awareness, educate, empower, and influence corrective behavior going forward. The programs we have set out touch on various interventions to achieve SDG 5, gender equality. Some of the programs are already underway, but need support in order to maintain momentum that yields desired impact. During the month of June, we had a film festival that really spoke about addressing the issues of gender-based violence and women empowerment. And during this month, Red Card have teamed up with Boots for Africa, an initiative that was endorsed by ex-FIFA president, Mr. Sepp Blatter, through TM Active to help the kids get for their football careers and teaches them about gender-based violence. It was good to see South African top athletes coming on board and making a change in our communities. And we are using their voices to create more awareness regarding gender-based violence. We're using their voices to send the message that can be heard and taken seriously as the sports heroes in their own right. We know that when a superstar talks, people listen, the kids listen, and they act as well. We also had a silent march where top players pledged their support, including Mrs. Mokoena, the mother of the late Karabo Mokoena, who was brutally killed and made headlines all over the world, also pledging to give a red card and saying enough is enough. Red Card has also partnered with men's network forums to groom a boy child to respect girls and women from early childhood. We cannot continue with life as usual as GBV is not normal. We as women cannot continue to cry and be hurt by our sons and men. We must work together as women and men. We want to see change, and it will only come when we work hand in hand with men, side by side, singing the same voice. August is the Women Month in South Africa, and we have planned a set of webinars that will address and force South Africa to unite and eradicate this pandemic. On the 24th of September, we will also be having an international summit for the women of the diaspora, focusing on anti-racism as well, as we have seen it in an issue, saying women life matters. In conclusion, we cannot do this alone. We need the world to stand up with us and pledge to give red cards to all forms of discrimination against women and girls. We call upon you to pledge on www.redcardpledge.com and let us collect 1 million pledges that will give us a voice and enable us to call world leaders during FIFA World Cup in 2022 to address the SDG 5 gender equality. I heard my colleague from UNICEF saying that they have committed to assisting to curb the gender-based violence. I'm saying the challenge is on. Let us give the red card. Let us all pledge. Thank you very much.
Lala, before you go, I would like if you could just say something about the cooperation, the memorandum of understanding signed with FIFA, and also with UNFPA and other organizations related to the United Nations.
So Eden has signed a memorandum of understanding with FIFA. Hence, we are going to be using the platform during the World Cup in 2022. We've also signed a memorandum of understanding with UNDP UN Women, UNFPA, you know, in achieving the Sustainable Development Goals by 2030. So we're working very closely with other NGOs as well, Gordon, and we've also got other government, you know, departments that are really behind us and saying we cannot fold hands anymore. Enough is enough. We need to give a red card to all forms of discrimination and violence against women and girls.
Thank you very much. Thank you very much. I think we'll now play that video that you have sent us. Okay.
Thank you, Gordon.
Thank you so much.
And that's how long it's taken me to give a red card to all forms of discrimination and violence against women and children across the world. We know that in South Africa, we continue to be haunted by hashtags #AmINext and movements that showcase women who have brutally been murdered at the hands of men. Siyoyika singabafazi base-South Africa. Inhliziyo zethu zibuhlungu. We ask that the men of South Africa stand with us in saying we give a red card to gender-based violence in South Africa. For this is a fight we can't fight alone, and we challenge you as our fathers, brothers, uncles, to isolate the perpetrators around you, to isolate those guilty that you know so that they don't feel comfortable in your presence. How long will we continue to hashtag #AmINext, to live in fear, and for this to be an issue that supposedly has no consequence in South Africa? We can't wait for leadership to stand with us. We in society need to take that stand together and fight it. See Misengembambo in South Africa and make this country uncomfortable and the men who are guilty of such uncomfortable. Enough is enough.
Thank you.
Thank you, Gordon.
Thank you very much, Nonhlanhla. That was beautiful. Wonderful presentation. Love the video. Thank you. And with that, we will go to our next speaker, and that is Clarisse Mefotso Fall. And she's from Africa Hope Foundation. Clarisse, are you ready? Let's go.
Good afternoon or good morning to everyone. I just unmuted myself. I hope you all can hear me.
We hear you.
Okay, good. So thank you for this invitation for a subject and a topic that really holds us here at African Hope for the work that we have been doing since for the last 16 years in mobilizing and providing service such as health, education, and social support to women and young girls here at the local, national, and international level. So the mission of the organization African Hope Committee is to provide, like I just said, health, education, social support to African immigrants and other immigrants groups here at the local, national, also international level. So our program extends at the global level. So at the global level, we really focus on health, education and literacy, and also water. So we do water. So the organization exists since 2004. And now that we're talking about COVID-19, it's a viral disease, and it's not far from what we have addressed for the last 16 years here. Prior to that, the first 10 years, we have addressed a lot of the HIV and AIDS here at African Hope by mobilizing women and children, to discuss issues that affect women affected by HIV and AIDS. So we have done that for almost 10 years. We brought, thousands of people, through the conferences that we used to host called HIV and AIDS, African Women HIV and AIDS, Women and Children. So where people will come at the local, national, international level, we have to mobilize also, the CDC and the Department of Health here, other institutions like the Harlem United, allow other NGOs here to partner with us and then to address HIV and AIDS of women. So we had great speakers from different institutions like Columbia University, New York University, and Department of Health, CDC. And we also mobilized, most pharmaceutical companies like Pfizer, most of the pharmaceutical company partner with us, to address HIV and AIDS, in the past. And we hosted those events, for about 10 years until some of the funds was completely decreased because it was all shifted, more into a clinical services where you have to have a program where you provide like the testing or treatment. So African Hope, our mission is to really increase awareness, education, and information. And that's what we have been doing. And we have done that, at a greater scale, local, national, and international level. We do education. One of our major programs here is education and literacy. And we mobilize books. And one of our great donors, for books, it's a CBS News broadcast here in New York that provide us with books where we send them to Africa. Okay, we have open, a library in Africa in Cameroon with the partnership of the Smiling Foundation. Together with the Smiling Foundation, we have open, a library in Cameroon, and we also have shipped books to other part of Africa like Nigeria and Senegal, also I think Morocco. So that's the book. And I just came back from Africa, from Cameroon, where I went to inaugurate this library at this school, where one of our partners, it's also our honorable member that runs schools in Cameroon. He has at least 4 schools in Cameroon. Mefotso. So I went there to inaugurate one of the library that provide education and education in English. So it's a bilingual school. So the lack, of English book, was greatly needed in that school. So together with the Smiling Foundation, we were able to ship, a whole container of books. And also we also very great in water. So we have built a water pump in Cameroon. And right now with the COVID-19, we're talking about COVID, and then we're talking about providing all these preventive items, in poor communities. I think one of the things that we should really look into it's water. It's water, and we have done that in a very local, rural area in Cameroon. We have built a water pump over there. So immigration is also our one of our main program here, immigration, it's, I'm the DOJ, DOJ accredited by the Department of Justice here in New York. I provide immigration services. And again, I work a lot with women and young girls, and I work very hard to address young girls and women issues when it comes to immigration, especially when they seek asylum or domestic violence, when we apply for VAWA. So I'm kind of an expert when it comes to women issues, because again, I profoundly address those issues when I process the asylum application, and also when I process, how do you call, the VAWA applications.
Thank you.
Okay.
Thank you so much for your presentation. I must say, you are an outstanding young lady, and you have committed yourself selflessly to work for the good of Africans in the diaspora and continental Africans. And knowing you, you also work for the good of humanity, for everyone. Thank you, Clarisse.
Thank you so much.
Okay. Our next speaker is Asiata Kamara from the There Is No Limit Foundation. Asiata, you may now take the mic. Let us hear from you.
Of course, thank you so much. What a rich conversation here. I just want to, first of all, acknowledge and honor the work of the organizers. We are grateful for each of you, and I share my sincere thanks for the invitation. And thank you to the panelists and to the attendees for taking their time to join this discussion. I also want to acknowledge that we are meeting under very difficult circumstances due to COVID-19. I hope you and your communities are staying healthy and safe, because COVID-19 is having an impact on all of us worldwide, but it is especially affecting the most vulnerable communities and risks to push back decades of socioeconomic progress. And so I was tasked with sharing our experience in ways our organization is helping to change the negative patterns that are being created by COVID-19. A bit of background: I was born in the Republic of Guinea, a country located in West Africa. The population size is approximately 12.5 million people, and more than half of Guineans live below the poverty line, with around 20% of the population living in extreme poverty. And according to the World Food Program, approximately 21% of households are food insecure. But it's not all doom and gloom. Though our country is one of the poorest in the world, I'd like to say that we are also one of the most promising countries, because we have a new generation that is willing to work hard, young people that are looking for opportunities to make a difference in their lives and in the lives. I know this because I am one of these young people, one of these young women. I started my organization, There Is No Limit Foundation, with my older sister in 2008 when I was still in college. And we had about $18 to put toward our vision of a community-led organization that will help protect the dignity and security of people. Each individual we work with determines what dignity and security means to them, and we run 3 strategic programs that are focused on sustainable development and entrepreneurship, education, and then clean water sanitation and ending gender-based violence. Our programs reflect the cultural context of our communities, and we constantly refine them based on feedback that we get from our clients, and those are the people that we serve. The work we do at There Is No Limit is really critical to alleviate the pressures that women and girls face daily. And I won't go too much into the macro level of these challenges, because I think the colleague from UNICEF and everyone else that has spoken so far did a wonderful job at that. But I just want to give you a little bit of a micro look into what is happening in Guinea. So as of July 20, Guinea has confirmed over 6,000 500 cases of COVID-19 within its borders since March 12, and approximately 39 hospital deaths. It is really important to understand that Guinea does not report on non-hospital deaths due to COVID-19, yet most individuals do not have access to health centers. And so there are real gaps in the numbers that are being reported. The Guinean ministry has been proactive, however. They created a hotline that individuals could use, and they've also enhanced screening and quarantine measures to reduce the spread of COVID-19. Similar to other countries, they've done things like declare the state of emergency. They have extended their curfew and required that areas like public markets are closed by 6 p.m. in the main capital. They also ask things like the wearing of masks in public places, and they limit the movement of individuals, and usually you're able to go to work, go to school, or shop as necessary. The reason why I'm sharing all of these restrictions is that they all have gendered ramifications. When you ask someone to wear a mask, there is a real assumption that they will have the money to buy those masks. And when you close down markets within a specific time, what you're doing is that you're limiting the income of individuals. And so when we look at our work, it is important to note that we work in some of the most remote areas in Guinea. We work in communities that are in the regions of Kisidugu, which are usually about 12 hours away from the main capital. And these communities prior to COVID-19 had a lot of challenges, right? Some of them were shared by the colleagues on the panel. So people were living without electricity, running water. They didn't have access to health centers or sanitation facilities. And the majority of them are subsistence farmers. But we are seeing through the work that we're doing, an increasing percentage of them actually also working in the tie-dye business and running other small businesses. We have seen throughout the years, and particularly during this time, very big issues associated with crop yield due to drought and really heavy rainy seasons. And this affects women, as we know, because they are oftentimes the ones that are working as subsistence farmers. This has resulted in the increase in labor input. So it means that, families are having to choose whether to send their kids to school or to add them to whatever pipeline of work that they have to do. And unfortunately, time and time again, these decisions end up affecting the girls. They are oftentimes the ones that have to be pulled from school and actually have to go and work with their families. The next challenge that is being faced, as I've mentioned, with the limitations on mobility and on the hours of work, is the availability of markets and employment. Already families were struggling with selling crops. Now they're struggling even more. Many of them used the opportunity to go to the capital to be able to sell their crops, and they are no longer able to do that. And sadly, and this is something that has already been mentioned, but I want to underscore, we are seeing cases of increased cases of violence. So those are domestic violence, but also very interestingly, we're seeing violence outside of the home. So especially the sexual assault of young girls. So right now, today, there's actually a story of a 7-year-old girl that was sexually assaulted and ended up passing away as a result of the attack. And as colleagues, I think it was a person from UNICEF mentioned, home is not always the safest place, but people are being asked to stay at home. And for the case of women and girls in Guinea, home is not a safe place, but you also have no real recourse or support to actually access services. Instead, you are always encouraged to bear the pain, to accept your faith. And that really is not the real solution for someone who is, for people that are going through domestic violence and gender-based violence. And it goes without saying, with schools being closed, we're also seeing increased instances of female genital mutilation in a country where already 96 to 98% of women and girls are already cut. So I'm telling you all of this is because of the fact that I also see a real opportunity here to redefine the ways that women and girls are thought of in the communities and to actually make them actors in the rebuilding effort. It is really important that as we think about all of the challenges that they're facing, that we develop necessary social services for them. It is important and critical that we give them access to services such as mental health services, because we have to address the trauma that they're facing. They need medical support, they need food, they need shelter, but they also need the mental services, because you have to think about these individuals, these women and girls as whole beings. And we can't talk about physical health if we're not talking about mental health. And so we have been doing a lot of campaigns, a lot of interventions to really share the different masks, to help with diversification of income, and to really just be an ear to women and girls, and to support them through what they're facing. We strongly believe as an organization that, you know, frameworks like the Sustainable Development Goals and the African Union's agenda are great roadmaps that are going to help us to build back better. But we really think that it is critical that governments, NGOs, put women and girls at the center of these efforts. And we also must ensure that everyone is investing in greener, more sustainable jobs and sources of income. As I've mentioned, with the huge shifts in climate, we can talk about going back to the status quo, going back to what it was before, because it was not working. And it was not working because we are facing real challenges on climate, real challenges around violence that need to be addressed. And so yeah, go ahead.
Thank you very much, Shahana. Thank you so very much.
My pleasure.
We're running out of time. We're going to have to have you back on another occasion. For I am extremely proud of you. I remember when we were working together on the Ebola epidemic back in 2014, how you and your organization, you partnered with the United African Congress and Give Them a Hand Foundation, and we did some great things. That first forum that we hosted in the ECOSOC chamber, and the major event we hosted in the General Assembly Hall, and you contributed so much to the success of both of those. And I've watched you. Now you are the Deputy Commissioner of Immigrant Affairs in the office of the Mayor of New York City. You are exactly what you are preaching to young girls and women. No limit.
Thank you so much. I really appreciate the invitation, and thank you for the time.
Okay, very good. Okay, we're going to move on to, even though time is extremely limited, we had expected to do this in 90 minutes, and it's now 90 minutes, so we still haven't had the Q&A. But I know so many people want to have the Q&A. They have questions that they want to ask. I've seen them in the chat, and so we're going to allow that to happen. We have a panel of experts, and they include Dr. Mohammed Nur Hussain, Chairman of the United African Congress, Professor of Medicine Emeritus, former Chief of Geriatrics at the State University of New York Downstate Medical Center. We have Dr. Judy Kurliansky, United Nations representative of the International Association of Applied Psychology, professor in the Department of Clinical Psychology at Columbia University, Teachers College, and trustee of the United African Congress. We have Mr. Milton Alimadi, a Ugandan by birth, adjunct professor of African history at John Jay College, a Pan-Africanist, human rights activist, and a publisher of the Black Star News. Ms. Stephanie Evans, Director of Education and Associate Professor at the Harlem Hospital. She's a Director of Give Them a Hand Foundation. And I will afford each of the panelists an opportunity to ask a question, starting with Dr. Nuruzain. Dr. Nuruzain?
Yes, can you hear me?
Oh, yes, we can.
Yeah, I am just simply blown away by the presentation. Each and every one of the presenters were superb. If there is anything that the COVID-19 has done is really bring to the forefront the urgency of addressing this issue of gender disparity and discrimination. The question I want to ask really is, part of the problem is lack of access to education for girls and also healthcare, women dying while giving child during birth needlessly. So is there affirmative action, a sort of affirmative action program by governments, let's say South Africa or Zimbabwe, that would help perhaps keep girls in school? Most of them leave early during puberty for obvious reasons. And is there an affirmative action program? I just wanted to address that. Shahana, perhaps.
Shahana, that question is for you.
Thanks, Mohammed, for that question. So in South Africa, schooling is compulsory, especially at primary school level. So all children are expected to be in school, and so we have high rates of attendance at school. However, often the issue, particularly at high school level, the issues of teenage pregnancy often leads to exclusion of girls, and particularly in poorer communities, where there are economic difficulties or lack of access to sexual reproductive health, then those kind of situations make it more difficult for girls to attend school. Of course, there are programs, the question of how effective they are, how much outreach they have, the social cultural norms that continue to keep girls out of school or impact on these kinds of issues. But comparatively, we have quite a high rate of young women in school, but this is not as much the case when it comes to higher education. I hope that addresses your question.
Thank you very much. As we're talking about school, Dr. Nuruzain, did that satisfy you?
Yes, it does, in a way, but I was wondering if Dr. Sophie also could chime in Zimbabwe.
Talking about schools, there is someone in our audience that I wish to acknowledge. He was the president of one of the preeminent universities in the United States, one of the preeminent Black colleges, the Tuskegee University. His name is Dr. Gilbert Rochon, and he's in our audience, and he has attended many of our conferences. I hope we can find him somewhere out there, but he's there. So now I will move on to the next question from Dr. Judy Kuriansky.
Thank you so much, Gordon, and everybody for this riveting presentations. I have here, guess what? My red card from Nonhlanhla. How do you like that? This is from the event at the United Nations, the last one before it closed, and a magnificent presentation about how important this is. And I learned at that time that the red card is the violation in soccer. And so this is a violation against women. We all must sign up. I did. And so you saw the pictures with my students also from Columbia University Teachers College who were at that event also. So hats off to them and all of you. My question relates to how men and boys can get into all of the issues that you've talked about, because we know that we cannot deal with solving some of these issues without them. I recognize the importance of SDG 5 that you've mentioned, about empowerment of women and girls, and Clarisse, the beautiful statement you made about mental health support, and Johanna, your work about social work. And so how do we get men and boys involved?
Thank you, Judy, for the question. Judy, I think you cannot do this, you cannot fight gender-based violence in isolation without including the men and the boys. We have to actually groom our boys to ensure that they understand the damage that GBV does to the women. You know, I think in our society, it's just become a norm, you know, that boys, you know, will talk badly with the girls. But so we need to ensure that they understand at a very early age on how to respect the women, and also to ensure that they are not the perpetrators, you know, of the gender-based violence. And again, we've seen that, you know, as we are advocating for women and girls, we need to also strike a balance, you know, with the boy child as well. So we cannot do this thing in separate, but we need to strike the balance between the two.
Thank you. Thank you. I have a question from the audience that I would like to pose. It's directed to South Africa, but I'm going to change that and direct it to Zimbabwe, really. And the question is, what the impact looks like among women from different racial backgrounds. And I would throw in not only racial, but economic, racial and economic background. So if Dr. Sophie is present still, I know she is actually, could you answer that question, Sophie? Yes.
Okay, can you hear me now?
Yes.
Yeah, thank you for the question. I think here in Zimbabwe, the bulk of the women who are heavily impacted are African women. And generally, the percentage of African women here in Zimbabwe is over 90%. The other racial groups are quite a very small proportion. So in terms of being impacted economically, the majority of the people impacted are African women, mainly because they are the ones who are more unemployed, and they are the ones who are engaged in the informal sector. And so as such, it is Black African women who are heavily impacted.
And while you're there, I have another question from the audience. It's for you.
Thank you.
It's a tough one. At our last interfaith event we had at United Nations with Christian, Muslim, Buddhist, Hindu, who else? On the stage.
Jewish.
Who else?
Jewish.
Jewish. I'm sorry I left that out. On the stage, I posed a question and no one answered. It goes like this. Don't you think it's time for theologians in general to update the interpretation of the holy books, which are root causes of gender inequality? I don't know if you tackle that.
Thank you. That is exactly what we are advocating for as the circle of concerned African women theologians. Our major reference point is on how scripture has often been used or manipulated to justify violence against women, the oppression of women. And so we are saying scripture per se is not bad, but it is how people misinterpret and abuse scriptures to justify social injustice and gender inequality. So yes, there is need for a much more gender inclusive reading of scripture and application of scripture, which celebrates the humanity and dignity of men and women.
Thank you. Thank you very much, Sophia. Now I'll go back to the panel and ask my colleague Milton Alimadi to pose this question.
Yes, first of all, this has been my favorite of all the webinars so far that we've had. Now, of course, part of the problem is that since most African countries won independence 60 years ago, it's been really men who have been messing up most of these countries. Let's admit it. Let's be honest about that. So part of the solution is to have women politically and economically empowered. The first thing I would like to say, this webinar, I hope, will allow all of the speakers today to find a way to work together and to collaborate on some of these efforts. So I think this is a good opportunity to take advantage of that. I have a question for Dr. Chirongoma and Shahana. You know, the African Union has an annual summit every year, right? What about developing an annual summit just for women to discuss some of these issues? Because part of the challenge is education. We need to find a way to instill in curricula in every African country, a way to educate men and boys that women are not objects, right? So perhaps you could respond to that possibility. To Eric Dentor, who is doing a fabulous job with UNICEF, is there a possibility of getting around the idea of creating safe homes or safe spaces for women in every African country? And this is going to be needed regardless of whether we have the pandemic or not, where they can come together to get away from abusive situations at some point. And while there, they get education, they get treatment, they get job training. I like what the young lady said, Aissata Kamara, in terms of starting her own organization at a very young age. My question to her is, can you teach other young Africans to do that? Because in situations where the governments are failing to provide jobs to young Africans, that's why we have unemployment at 90% in Zimbabwe, 60%, I think, in South Africa. In Uganda, it's 80%. So increasingly, young people are going to need to create their own jobs. So that is my question to you. Can you find a way to educate more young people how to actually create their own jobs? To Ramasan in Madagascar, you talked about food distribution, and I know it's very challenging right now. Is there a way to promote mobile units that go into all these communities and distribute food and also maybe distribute information and literature? Thank you so much, all of the speakers. I think also, though, one of the audience members sent a question about the racial breakdown. And I think, if I understand it, she also wanted to get a response from South Africa, where the racial dynamics are still very fluid. So maybe Shahana can go back to that question again. Thank you, all of you, for your excellent presentations.
And thank you, Milton, for your questions. Perhaps Aissata will want to address that, one of the questions you posed about how to get the other young people to form their own organizations. Aissata?
Of course. Thank you so much for that wonderful question. I think that it is critical for young people to start creating their own jobs. As you've said, we've gained our independence for over 60 years, but our fathers and grandfathers still stay in power, and a lot of young people are out of jobs. The key thing is that young people have to first get into the mindset that no one is going to rescue us. We have to rescue ourselves, and that we do not need to have billions of dollars in order to create new industries. So it's really important that we start where we are with the resources that we have. So through our organization, we work with a lot of young people, and some of them just start little restaurants that are called Mackey's, right? They're just maybe 2 chairs and then just the place where they make the food. And then if they just stay in that, within a year, they're able to actually expand. So it's about starting where your resources are, and then also not doing the same thing that everyone is doing. We have a great African Union Youth Envoy, for example, who's now asking young people to get into the arts and to actually get involved in the creative industries, because we all want to be accountants, lawyers, and doctors, but we also need the tailors, you know, the technicians and all of that. So that's my response to you. And thank you for the great question.
Thank you, Aissata. Maybe Shahana, would you like to take a shot at the question posed about the racial makeup of in South Africa, how it impacts on the different races?
Yes, thank you so much, Gordon. And Milton, thank you for those very interesting questions. With regard to the African Union, I think the points made earlier about gender and that men and women need to work on this together is that whilst it's great for us to get together as women, often we try to convert the converted. And so we really need to be working with men, and within the African Union, everything needs to consider gender. If we don't look at gender within every goal, sustainable livelihood goals, African Union goals, anything that we do, half of the population is left out because there are gender dimensions to most aspects of development. With respect to gender, race and gender, I think in South Africa, the race, gender, and class dimensions are critical. Unfortunately, I didn't have enough time to talk about that because it requires analysis on its own, but particularly Black women are most vulnerable to most issues when it comes to COVID. So access to food, so food insecurity affects Black women the most. In fact, they're often female-headed households are one of the highest in South Africa, and they're often responsible for caring not just for their own children, but the burden of care within communities as well. Also, a lot of the women who are working in insecure labor, such as domestic workers, are incredibly vulnerable to job losses, but also that when they're in those contexts and traveling, they're vulnerable to sexual violence, they're vulnerable to exploitation. So definitely the question asked by one of the participants around race in South Africa is still a critical dimension. 25 years post-democracy, but those dynamics have not shifted enormously. There is a growing elite Black community, but the majority of Black women are still disadvantaged, still at the bottom of the rank in education, in health, in welfare, along all sorts of dimensions. I do think the one thing that has shown real progress and helped a lot in South Africa is the childcare grant. It's very controversial, but the impacts of the childcare grant in terms of giving women access to an income so that they don't have to engage in intergenerational and transactional sex has been very powerful in the South African context, and it's shown valuable in terms of helping women to become entrepreneurs and having access to financial resources. So as little as the grant is, it's been useful. Thank you.
Thank you very much. Milton, I think you had a third part of that question.
The safe houses for Eric, those safe houses. And I don't know if Dr. Chirongoma also wants to talk about the annual conference of women. But the safe houses for Eric, definitely.
And then we move on. Eric?
Yeah, thank you so much, Milton, for this question. I think it is very important for safe houses or safe spaces. The only thing I want to maybe start with is that most of the time we talk about safe spaces, there are two things that come into people's mind. You're talking about venues where people can come to socialize, to learn skills for making healthy decisions, to receive services, as well as the safe shelters where women who are in abusive homes need to go for protection. So we need to distinguish these two completely, because most of the time people get confused as to when you talk about safe space, they are thinking about the safe shelter. Safe shelters are also necessary, but in terms of setting up the safe shelters, they have to take some consideration into being safety consideration, because if women or survivors of gender-based violence get there, they should be able to be protected from further harm. But on the safe spaces, that is something that we support and we encourage that, because like I said, these are venues where women and girls can come to socialize, to share their problems, and to also learn skills for making healthy decisions. And this is something we have been supporting in different countries, working with the government, working with the partners to make sure that these safe spaces exist. In some contexts, we see that these safe spaces are actual structures. In some spaces, like when I was in South Sudan, we even saw safe spaces that were just under the tree. where a group of women could come and have some discussion. They were also being considered as safe spaces. So we actually provided some guidance in terms of how these spaces should be run, how they should be developed. One thing that I would want to recommend is that in setting up these spaces, it is important that women and girls are consulted in the process of how to set them up, where they should be set up, what activities should be run into them, and even the names we gave them. Because my experience, I know when I was in Liberia, in fact, we used to call them women's centers. And then the men say, oh, why is it that we cannot go to the women's center? These are not our centers. And then at the time, we decided to call these centers as community centers. When we call them community centers, the men took over the center. They were having their meetings, they were having time to play their kept up and all of that kind of stuff. So the women didn't have time to basically use the center. And guess what? Even if you don't create men's centers, men will always have spaces to meet. So I think it is a deliberate push to make sure that we actually go back to say women and girl-friendly spaces or women and girls safe spaces. So this is something deliberate, and it's not saying that men cannot also find place, because they will always find place to meet. Thank you so much. But it's something, if I just one point to close, with COVID, we also noticed that access to the physical safe space challenge. So UNICEF is also supporting what we call the virtual safe spaces. So this is something we are piloting in Minaro and in the Middle East, and we are also trying to see how best we can pilot that in Africa to see if access to physical safe spaces is not possible. How do women get connected to the services and help-seeking mechanisms that are available? Thank you.
Thank you.
Thank you very much, Eric. Thank you very much. I know we'll not move to the other member of our panel, Stephanie Evans, and for her to pose her question.
Gordon, as you know, normally we do wrap up, so I think my question is a more general question. We have involved males in reproductive health. We've involved males in other areas of healthcare. And often when we see women who are victims of violence, often they're alone and there's no reformation in terms for the men to be involved in some kind of educational process. So my question in the short time that we have, the 5 minutes, so that means a short time for everyone, to Eric and the panelists, how do we end and prevent gender violence? So Shahana, Eric, and others in the short time we have. So my question is, how do we, given all the factors that we now know, how do we end and prevent gender violence, and what can we do?
Should I start?
Yes, sure.
Yes.
Start and then I'll
Anna, take a shot at it.
Okay, I think one of the critical issues is really the education and re-socialization of young people. So the way we bring up our boys and girls in communities, and looking at retraining around gender attitudes and social cultural norms. I think the issue of religious leaders and community, how do we change the social cultural norms that currently exist, and the way in which religious texts, as we've been discussing on the chat, are being used to entrench gender inequality. And so working with communities, I think that we work a lot sometimes with service providers, but by the time women seek help, it's very late. They're seeking help from community along the way. They're seeking help from their mothers, mothers-in-laws, who are sending them back to abusive relationships and other family members. So we're not working at the grassroots level enough to change these gender attitudes that entrench gender-based violence and other kinds of discrimination against women and girls. Thank you.
Eric?
Thank you so much. I think just to add up on that, I think this is an interesting thing. Just going back to the conversation we started. First of all, if you look at gender-based violence and gender inequalities, you have to first look at what are the root causes. So you look at the root causes of power abuse, you look at root causes of gender inequality, you look at the root causes of not respecting human rights, and then you have the contributing factors. So sometimes, like in situations like this, if you have an emergency, what we do most of the time, we look at the risk mitigation. How do we reduce exposure? Well, if you have an emergency situation, it's not maybe enough for you to actually address the root causes that are deeply rooted in cultural norms, in social norms, and all of that. So like my colleague mentioned, working with the communities in terms of how do we address the social norms is important. First, if you have young children, we are all born boys and girls, we are growing up. How do we really learn how to respect women, so this is a process that continues. How do we engage them into that? But then also when they become adults, how do we engage them into conversation? I mean, we have programs that are thinking about addressing social norms. How do we commitment to taking some action to address this? So it's a process in terms of addressing issues of gender-based violence, but we have to look at it at the stages. We look at the risk mitigation. How do we reduce exposure? How do we address the root causes and then how do we provide support to survivors? So the three components have to work together. Then in emergency situation, then we focus on risk mitigation. But as the situation gets a bit more stable, then we start looking at the social norms. Thank you.
Thank you, Eric. Last.
Dr. Sophie, and then we oh, you.
Go ahead.
No, I said Dr. Sophie, and then I think we're almost out of time. Yeah.
Dr. Sophie? Okay.
Okay, yes. Okay, thank you. Yes. Okay, I would like to highlight the fact that as the SECO, we are also working closely in collaboration with other men's organizations and other individual male advocates for gender justice. For example, in collaboration with the World Council of Churches, we are actively involved in an advocacy movement called Thursdays in Black. And every Thursday we wear black and we'll be putting on badges. I hope you can see the badges that highlight that we are in solidarity with women who are suffering from sexual and gender-based violence. And we are therefore saying no to gender-based violence, particularly rape and sexual violence. And so we are advocating for a world without rape and sexual violence as men and women of faith in solidarity. And also in collaboration with the Young Women Christian Organization, which is also a global movement, we are also advocating for a creation of safe spaces for women and girls suffering from abuse. And we also even sometimes participate in the African Union meetings where we are there to speak on behalf of marginalized and oppressed women in Africa. So also even in our academic engagements, particularly as SECO academic theologians, we highlight the need for mainstreaming gender justice. For instance, one of the major and very popular courses in religious studies and theology is one that focuses on masculinities and femininities, where we emphasize on both redemptive and positive masculinities and femininities, where we are highlighting the need for socializing both women and men to embrace positive gender interactions. Thank you.
Okay, well, thank you very much. We are at the end of our program. I want to thank Professor Shahana Rasool, Sir Eric Dentor from UNICEF, Dr. Sophie Chirongoma, Mino Ramarosan, Nonhlanhla, Clarisse, and I wish to apologize for Clarisse for having to cut in to her presentation, and also welcoming and thanking Isata, and I wish to apologize also for doing that, but obviously we're running out of time. You were all fantastic speakers. We learned so much from you, and you have established a vibe that, as Milton said, we need to stay together and do something and use what we have created together for the benefit of women and girls and society on a whole. I also want to thank those who worked in the background, Maura, for doing the technical work for us. And in wrapping, I want to give some ideas. All stakeholders, governments, UN agencies, the private sector, and civil society organizations, should prioritize resources for women and girls in Africa, especially in these times of COVID-19 when women and girls are in danger, to promote gender equality, human rights, and social justice, to put human rights, including gender equality, at the center of the frameworks in Africa for international policies, national and local development, especially in rural areas. Eliminate stigma and discrimination against women and girls. Support the UN SDG's policies and recommendations about attention to women and girls' rights, especially against domestic violence and violence of all types. Support the SDG 5 and UN agencies like UN Women, UNFPA, UNICEF, and others in their work in Africa. Support programs by civil society organizations like represented in this webinar in their work for their rights and protection of women and girls in Africa. Provide access and training to productive employment and decent work, and to provide and strengthen access to primary, secondary, and higher education. And in closing, I want to let you know that all of you, anyone who wants to be in contact with us, can get to us at info@gtah.org. That's Give Them a Hand Foundation. info@gtah.org or GM Tapper, GMTAPPER @gtah.org. I look forward to hearing from you, and thank you all so very much. Thank you, everyone. Bye.
Thank you. Thanks, Gordon, everyone.